Welcome to the WMed Specialty Spotlight Podcast, your virtual mentor for choosing a medical specialty and planning a career in medicine. On this podcast, we probe practicing physicians with questions about their specialty, the decision algorithm that helped them determine that the specialty was right for them, and then for advice about long-term career planning, irrespective of the field they went into. I'm your host, Dr. Biren Shah, WMed Assistant Dean for Career Development. The specialty of today's show is family medicine, and the physician here to tell us about it is Dr. Kristi VanDerKolk. Dr. Kristi VanDerKolk is a family physician and program director at Western Michigan University Homer Stryker's MD School of Medicine in Kalamazoo, Michigan. She earned her medical degree at Wayne State University and completed her family medicine residency at the University of Michigan. Her clinical interests include both inpatient and outpatient family medicine, as well as care of gender diverse individuals. So without further ado, Dr. Kristi VanDerKolk. Dr. VanDerKolk, welcome to the show.
Thanks, Dr. Shah.
Well, thank you for being here. I'm excited to have you talk about the specialty of family medicine. To start us off, I'll read a description of the specialty from the Association of American Medical Colleges Careers in Medicine website. Family physicians provide frontline health care that is accessible, high quality, comprehensive, and continuous over time for people of all ages, life stages, backgrounds, and conditions. They care for individuals and for entire families from birth through the end of life, including a broad range of preventive care, healthy lifestyle counseling, mental health care, care of acute illnesses, management of chronic diseases, including patients with multimorbidity. When needed, they also provide referral and coordination of care with other specialists. How much of that do you agree with? What would you add or subtract from that?
I think I agree with all of the definition that has been put out by the AAMC about what exactly family medicine is. The concern that I have with the definition is that it leaves out all of the things about family medicine that make it fun. So that's a very dry description of what it is that we as family physicians do every single day. And I think it's very accurate. But what I think is important is the fact that we do all of those things within the context of the community that we live in and within the context of each individual person's life and society. And so my medical practice has been shaped and changed tremendously based on the needs of the Kalamazoo community. I do things here in Kalamazoo that I was not necessarily trained to do during my residency, but that I started doing and learned how to do well based on patients whose needs were not being met in other areas. That ability for your community to shape your practice is a really unique piece about family medicine and really kind of keeps things exciting. And then all of the care that we provide, continuity of care and comprehensive care and people of all ages, that's all done within the context of their social lives, right? And so one thing that family physicians are really adept at is taking into consideration what it means for a person who has diabetes to not be able to make it to the grocery store regularly, or for a child coming in for their well child exam who is having difficulty getting food outside of school, for instance. And so I think that ability and that desire to provide care that works for patients keeps you on your toes and makes it exciting day in and day out.
What is the typical daily or weekly routine that you see in in your family medicine practice? And what is the typical patient and what's the typical outcome for this patient look like?
I think one of the cool things about family medicine is that this question is relatively unanswerable because there is no quote unquote normal day in family medicine. I can distill it down to, most family physicians who are seeing patients, say in an outpatient clinic or office, are seeing between 10 and 15 patients per half day. And they're seeing patients who are newborns all the way up to 100 plus years of age. They're doing well child exams and health maintenance exams and pap smears and cancer screenings. And they're also taking care of things like diabetes and hypertension and hyperlipidemia, coronary artery disease, cardiovascular disease, all of the things that we see so much of in the US healthcare system. And then they may mix into that some procedures here and there, like removing a suspicious skin lesion or placing an IUD or removing a toenail. And then kind of sprinkle on top those run-of-the-mill colds, my finger hurts, etc., to kind of round out the day. So that's what it looks like from an outpatient point of view.
It's really interesting, that your day is unique in of itself. So can you tell me rough percentage of patients you see that are adults, kids, and obstetrics patients?
The vast majority of the patients that we see in family medicine are adults, and that ranges in age from 16, 17, somewhere around there, up into 50s, 60s plus. I think about 10% of our patient visits here in our clinic are pediatric, and in some instances, that number is a lot higher, just based on the needs of the community and availability of pediatricians and things of those nature. But also, by their nature, children need medical care less frequently than adults tend to. And so for that reason, I think, you're always going to see an emphasis on adult care. In terms of obstetrics, we do probably close to 70 deliveries a year. And so we are seeing patients every single week for their obstetric care, and probably seeing 30 plus patients per week in terms of in need of prenatal care and in need of services for delivery.
Due to the depth of your training, do you ever feel stretched too thin? And do you ever feel uncomfortable that you might not know enough about one area of your training that you're supposed to command?
From the perspective of feeling stretched too thin, I really don't experience that really ever in the course of caring for patients. And I think that's because I went into family medicine because I wanted to have that variety on a day by day and an hour by hour basis. And so that's part of what I really love about what I do. And it gives me the opportunity to continue to learn and expand my knowledge. I think that all physicians, in my experience, have periods of time in which they feel like they don't know enough. And that I don't think is unique to any one specialty. And I think it's a common thing with physicians who have a person's life in their hands to feel like, wow, I wish I knew better how to help this person. And that just really speaks to the import of the continuing medical education and the lifelong learning that is a part of every physician's career.
What is generally considered to be the most exciting about your specialty, and what would you consider to be the most mundane about your specialty of family medicine?
I think the most exciting thing about family medicine is that you never know what you're going to do next. You never know what disease process is coming in. You never know what age the patient is. You never know what gender the patient is. It could be anything. And that really keeps you on your toes throughout the course of the day. I mentioned earlier, too, that I think one of the most exciting things about, or one of the more fun things about family medicine is really being able to provide medicine within that context. within that context of a family, within that context of a community. And, many family docs take care of generations of patients from the same family. And so, seeing someone's grandma and then also, knowing their grandkids and their kids and all of those things really gives you insight into the lives of the people who you're providing care to, and really helps you expand that idea of context to be able to provide the best care that you can. From a mundanity point of view, one of the things that's hardest about family medicine is that we really are the people who coordinate care within the healthcare system. And so it's our job to know what the surgeon said about our patient's hip replacement, or what the cardiologist wants to do about intervening on someone's cardiovascular disease. And so being able to collect and analyze and look at all of those specialty notes, and even in some cases obtain those notes, I think is one of the things that can drive a person to be a little bit stressed as a family physician. But also it's interesting because you get to learn every single time you read one of those notes about what a specialist who has more knowledge or more in-depth knowledge of that system would do for your patient.
What would you say is the differences between family medicine and med peds in training?
So I think one of the more obvious differences is that family medicine training includes obstetrics and care of prenatal patients, as well as intrapartum management and postpartum management. And so that is beyond the usual course of study in med peds. I think something that maybe isn't as obvious, though, is the emphasis on inpatient versus outpatient care. So while family medicine residents do a lot of inpatient medicine, the vast majority of the emphasis of their training is on outpatient medicine and building relationships and on continuity of care. And that continuity actually even extends into their inpatient experience, where they admit the patients from our practice that they care for in the outpatient setting, and then also care for them in the inpatient setting and back into the outpatient setting once their inpatient needs are completed. So the emphasis on inpatient medicine is, I think, a little less than med peds, and provides a little different window into the workings of the healthcare system because of that.
What is one thing you wish you had known before entering your specialty, and what would you encourage a medical student to think about in earnest before committing to go into family medicine?
I think one thing that I wish that I knew was just how hard it is to be a family physician. So I think there are myths that family medicine is easy, or you don't have to be very smart to be a family physician. But it turns out that that's wrong. You actually have to be incredibly intelligent and have a really good understanding of a lot of different things. I don't think that I know a little about a lot. I think I know a lot about a lot. And the more that I know about a lot of different things, and the more that I know about the complexities and varieties of interventions and care and disease processes, the better I do as a family physician. And so striving to know a lot about a lot all the time is really difficult. And it's just really, really difficult to be, in my opinion, a really good family physician. So then when I think about what I wish a student would consider before they come into family medicine, I think it's just that it's hard, that it's a lot of work to be a good family physician, and that you have to get joy out of what you're providing for patients. You have to gain joy in seeing good outcomes for your patients, or in providing good care for a person, or solving complex problems that take into consideration social determinants of health, in addition to preventative care and chronic disease management. That has to bring you joy, and that has to lift you up, because there aren't going to be easy days as a family physician. And so if you're not in it for the right reasons, it's not the right spot for you to be.
How does your practice of family medicine change based on setting? Academic versus private versus public, urban versus rural, civilian versus military?
Yeah, so we kind of touched on this a little bit, but again, more explicitly, the community and the environment in which a family physician is practicing really shapes what their practice looks like. And their practice is able then to provide for the needs of that community. So, say, for instance, many rural settings, family physicians are continuing to do inpatient family medicine, as well as urgent care or emergency medicine. They're doing prenatal care and intrapartum care, and they may even be doing some general surgeries, things like appendectomies or C-sections, for instance. There's really a very wide scope in some of these areas that are historically underserved by specialists, or in areas of the country where people just have less access to specialists to begin with. That same scope of practice is often preserved in the academic environment as well. And so myself, I do both inpatient and outpatient family medicine. And I have colleagues that are doing the same, and also doing intrapartum obstetrics as well. And so that scope is really, to some extent, dependent on the community in which you are living in, and in your own personal desire to continue to offer that full scope of care. I think also that, again, community plays a big role. So if you're in a community that doesn't have a urologist available, maybe you're doing a lot more vasectomies. Or if in your community it's difficult to get dermatologic care, maybe you're doing a lot more skin exams or biopsies, et cetera. And so, again, your practice is easily tailored to what the community needs, and then also what you're interested in. So if you're really interested in pediatrics and you're good with kids, people in the community are going to hear about that. They're going to know about that, and more kids are going to come to your practice. And so really what ends up happening is a family medicine practice that both suits you and suits the community that you're living and working in.
That's really nice. I mean, that variety and that ability to kind of shape the practice that you want. What would you say is the biggest challenge facing family medicine, and where do you predict your specialty to be in 10 or 20 years from now?
So I think that medical reform in general is a challenge to the system in the United States. And in particular, when I think about family medicine, I think about us as being a specialty that is affected by any of the healthcare reforms that happen, pretty directly, being that we're somewhat ubiquitous within the system. We're present everywhere, right? Because people need family physicians, they need preventative care, they need an entry point into the medical system, and we serve that role. So I think then changes that have occurred, or struggles of the medical system overall, have really impacted family medicine. So things like medical staffing, and payment reform, all of those things really impact the day-to-day work of family physicians. And I think that one of the biggest concerns that I have for the specialty moving forward is maintenance of a workforce, and continuing to garner interest amongst medical trainees, to go into the specialty of family medicine, as difficult as it is, because we need more family physicians in the United States. In 10 to 20 years, I'm hopeful, at least, that we will be moving toward a system in the United States in which primary care is really the foundation of the US healthcare system, and that we have a decreased focus on specialty care and an increased focus on preventative care. And that increase in focus should also come hand in hand with increased investment in things like family medicine, as well as general internal medicine, general pediatrics, those physicians that are providing outpatient care routinely. And I think that that is going to come with a change in what has been a high cost, high fragmented, and somewhat low quality system that focused on specialty care towards one that's much less fragmented, and that provides much greater quality of life to patients, and at a decreased cost to the system overall.
Let me ask, as far as resources, and what resources would you recommend students to use or turn to learn more about the specialty?
I think the best resource out there is the American Academy of Family Physicians. So that is the Academy of Family Medicine, and they have a lot of information on their website about what family medicine is, the scope of practice within family medicine, how to approach matching into family medicine, lots of other information as well. And membership is free, actually, for any medical student. And so anyone can join the Academy and learn more about family medicine. You can also access a lot of it without being a member, but joining, as I said, is free and opens up some other avenues for further exploration as well.
Can you tell me your story of how you chose family medicine, including any struggles, insights, that aha moment that made you decide family medicine was right for you?
I originally went into medical school knowing with absolute certainty that I was going to be a surgeon. And obviously I'm not a surgeon, so that didn't really work out. But I think that was an area of medicine that I had a lot of exposure to, and that I just thought that, given my interest in working with my hands and those sorts of things, that would be something that I really enjoyed. And I did a surgery clerkship relatively early in my third year and realized that I was not enjoying myself. And while I found it interesting to be in the OR, I also found it difficult not to focus on my nose itching or the fact that I had to go to the bathroom, and couldn't leave the OR theater. And so I really didn't enjoy it to nearly the extent that I had anticipated that I would, which kind of left me in a position of instability, right? Because now I had no idea what I was going to do, and I hadn't even thought about what I wanted to do beyond surgery. And so I went through the remainder of my third year really waffling about what I was interested in. And I knew that I had really enjoyed my initial rotation in internal medicine, which was primarily hospital-based. And then as I went through the rest of my third year, I was like, oh, I kind of like this. And I thought that about nearly every rotation that I was on. Oh, I like doing pediatrics. I like taking care of kids. This is really interesting. Oh, OBGYN, it's so exciting to catch a baby, and it's so interesting when things just escalate quickly and there's an adrenaline rush and all of those sorts of things. And so by the time that I was thinking about what it was that I was going to apply to, I was still really confused because I liked so many different things. And then I had the opportunity actually to do my family medicine clerkship, which was toward the end of my third year. And that's when I had that aha moment where I thought to myself, oh, wow, this is what I can see myself doing for the rest of my life. Because I got all of those pieces that I had liked during clerkship. I got to see adults and kids and pregnant people, and I got to experience the care of all kinds of different diseases and the discussion with patients about lifestyle and preventative medicine. And I just fell in love with it. And so that's how I got to where I am today.
Was there ever like a head-to-head decision between two or more specialties? And if so, what made you decide to choose that route that you did?
I think that all of the head-to-head decisions were one clerkship after the next, right? So, oh, I could do pediatrics, and then you go to OBGYN and you're like, oh, maybe I don't want to do pediatrics, maybe I want to do OBGYN. And then by the time I actually made the decision, it was like one choice of family medicine versus 15 choices. And so the head-to-head matchup wasn't really a thing for me.
If you were a third-year medical student, undecided on specialty with limited time remaining before residency applications were to be submitted, what do you think would be the fastest, highest yield route to making the decision about the specialty?
Rotating with a private practice family physician in the area. That gives you really the opportunity to see how a lot of family medicine physicians structure their practice in an environment that is very typical of family physicians, and that will give you that breadth of experience as quickly as possible.
Do you feel that away rotations are necessary?
No, I don't think that away rotations in family medicine are necessary for people who want to match into the specialty. I do think that if there are specific programs of interest for a medical student, that they may want to go and do an away rotation for 2 or 4 weeks, really to just get a feel for the culture and the people and see if they really do like it as much as they think that they do. But in order to be successful in the match, you certainly don't need to have done an away rotation.
And how important is research or scholarly productivity for matching into family medicine?
Family medicine takes a really holistic approach to match and to selection of candidates for interview. And so while scholarly work is good and is something that could certainly elevate your application, there are other things that are also good and may elevate your application to the same amount. So, participation in the street medicine team, for instance, or getting added education in lifestyle medicine, or whatever other opportunities there are within your own medical school that are of interest to you, will similarly elevate your application in the eyes of a program director.
Do you think there's anything a student should be doing to be a competitive applicant for family medicine?
I think the biggest thing is really being successful in all of your endeavors in medical school. So all of the different clerkships, and all of the different electives, and really getting the most out of those as a person can, because every single one of those pieces is going to be part of what you continue to do as a family physician. And so when I'm looking for applicants, I'm looking at people who have that, from whom I get that sense of well-roundedness or interest in all kinds of different areas of medicine, and who have really taken the initiative to get the greatest amount of experience and exposure possible.
If you could go back and do it all again, what would you do differently, and what would you do the same, and why?
I think that I would do things mostly the same, in that I really gave myself the opportunity to explore all kinds of different specialties within the field of medicine, which came at the cost, I guess, of not having any certainty about my future or where I was headed. But that really gave me an opportunity to see myself in all different areas of medicine, and to find what fit the right way or the best way for me. And so what I would do differently is not go into medical school knowing that I was going to be a surgeon, and just going into medical school knowing that I was going to be a physician, and exploring all that meant, and all of the opportunities that were available.
What career mistake that you've seen other physicians make, and what is something that you've seen another physician do well that has made you want to emulate that?
One of the biggest mistakes that I see with family physicians is really getting caught up in the fee for service and pay of family physicians, taking a position, for instance, that requires them to work in a way that isn't really what their style is, but it pays a lot, and so they think it's a good opportunity. When I think about the family docs that I most want to emulate, it's those that have really built for themselves a practice that makes them happy. And so that looks different for any number of individuals. In some individuals, that looks like longer appointment times. In others, increased emphasis on things like procedures. In some, continued intrapartum care, continued hospital medicine. And so those that have really been able to say, I'm in this for the joy of medicine and to care for patients, and not necessarily in this for the paycheck, have really been the people who I see as being the happiest, and who I would care to emulate in the future.
What is one thing that you're struggling with or lamenting about your career today? What are you doing to remedy it? And what would you encourage a medical student to do right now to help avoid this problem entirely later?
I often spend time worrying about or thinking about whether or not this career in medicine is actually worth it, and thinking about the amount of time that it takes away from my family, and the level of stress associated with it, and intermittent burnout, and having to deal with payers and prior authorizations and paperwork, and there are so many different frustrations with a career in medicine. And as I said, I get caught up in that from time to time. I think that the one thing that I do that helps remedy that when it starts to get bad, is to remind myself to have awe and wonder, and to be curious, and to say to myself or remind myself that I get to be a doctor. I don't have to be a doctor. I get to be a doctor, and I get to be involved in some of the most intimate parts of people's lives. And I get to see interesting disease processes, and I get to learn about new things all of the time. And so having that wonder and having that curiosity really reframes the art of medicine and the joy of medicine for me, and reminds me of why I put up with some of those frustrations on a day-to-day basis.
I want to ask you, as far as what is one book, medical or non-medical, that you think every person pursuing a career in medicine should read?
One that comes to mind first for me is a book called Caste by Isabel Wilkerson. That book really links the caste systems of India, which is the stereotypical caste system that we learn about in history, but it links that system with the system of social hierarchy in America, and even with the social system in Nazi Germany, and really calls into question and really illustrates powerfully what kind of social hierarchy we've created in the United States and how that affects our interactions and our choices and everything we do on a day-to-day basis. And then also some things to help react to that or to push against that social hierarchy that exists and fight against those artificial human divisions that have been created.
I have to read that book. That sounds like a great book. Dr. VanDerKolk, is there anything that you think that we haven't covered that you want to add?
One of the really interesting things about family medicine is that it really grew out of this kind of a reaction to the specialties of medicine. And so it's almost like this subversive counterculture in medicine that really pushes against some of the norms of medicine and the fractured care, and feeds off of the social reforms in the United States and things like social justice and liberation of social minorities and anti-authoritarianism and things like that. And I find that to be one of the really fun parts about family medicine as well. Family medicine is a relatively new specialty. It was approved in 1969. And so it hasn't been around as long as a lot of other specialties. And that really just gives it a unique place in medical history.
Yeah, wow, I didn't know that's a fairly young specialty. Yeah.
Yeah.
Wow. And actually, question I do have is how many of your residents or just in general go on to do a fellowship? Because I know that there are fellowships one can do after family medicine.
Yeah, there are a lot of different fellowships available to family physicians, and I think approximately 25%, maybe a little bit less than that, of our residents pursue fellowships. And those fellowships have included in recent years things like sleep medicine, addiction medicine, surgical obstetrics, sports medicine has always been a really popular one, hospice and palliative medicine, et cetera.
Dr. VanDerKolk, I really appreciate you taking the time out of your busy schedule to talk with me. For everyone listening, I hope you enjoyed the conversation with Dr. Kristi VanDerKolk. For the resources and other tidbits that were mentioned in this episode, you can find them in the show notes on the WMed website. If you liked what you heard, please share this episode with your fellow medical students, especially if they're having some career anxiety. It truly is my hope that these conversations with physicians who have been there and done that will help you move forward with your career choices. For any questions, or if you'd like to reach out to me for any reason, which I encourage you to do, you can do so by emailing me. But until next time, take care.